Another important program for children is the one for children or youth who are leaving foster care at age 18. This is a vital program because so many young people lack the necessary support services after they age out of foster care. This can be an extremely important support service to maintain the child's health and well-being until she turns age 21. Under this program, the child must have been under the state's control on her 18th birthday. In other words, the state was responsible for seeing that she was in a foster care placement on her 18th birthday. If she meets this requirement, she is entitled to free Medi-Cal until her 21st birthday. Medi-Cal continues regardless of the youth's income, and there is no assets test for the program. There's also no share of cost for this program. Since the youth is under the age of 21, she is eligible for all EPSDT services. For information about EPSDT, please visit the websites noted at the end of this training. Next, we will talk about some other programs that are important for children and youth in Medi-Cal. One program to note is the Minor Consent Program. The Minor Consent Program is a program for children and youth from age 12 to 21 who need services to deal with sexual assault or other physical abuse, drug or alcohol abuse, or sexually transmitted infections. The program also offers family planning assistance, pregnancy coverage, and mental health services for children who don't feel comfortable getting their parents' or guardians' assistance in obtaining these services. A child may apply for and qualify for minor consent without her parents' knowledge, and the minor does not need to show any proof of the parent's income or assets. The minor may apply for this program at the welfare office, and no paperwork is sent to the home. A child may apply for this program on her own even if she already has full Medi-Cal coverage through her family. Since many families have income that fluctuates between Medi-Cal and Healthy Families income levels, the Medi-Cal program has several programs to keep children covered when they are transitioning between the two programs. There is a Medi-Cal to Healthy Families Bridge program to keep kids covered in Medi-Cal when the family income goes up too high for free Medi-Cal. The children in the family may qualify for Healthy Families, and the bridging program keeps them covered. The children are not enrolled into Healthy Families automatically. The family must complete an application for Healthy Families. For families that experience a decrease in income, which puts the children below the minimum threshold for Healthy Families eligibility, there's also the Healthy Families to Medi-Cal Presumptive Eligibility Program, or PE. This is also for children and families who apply for Healthy Families through the single point of entry, but who have income below the Healthy Families threshold. These children are enrolled into the Medi-Cal PE program while the local county office determines ongoing Medi-Cal eligibility. Now let's talk about programs for pregnant women. Pregnant women are covered under Medi-Cal up to 200% of the federal poverty level. Under this program, a woman can get Medi-Cal coverage for pregnancy-related care and postpartum care regardless of her immigration status. If she is a citizen or a qualified immigrant, then she can receive all of the services of full-scope Medi-Cal coverage, including pregnancy-related care and postpartum care for 60 days after the end of the pregnancy. To qualify for this program, she can apply at a prenatal care provider's office to get presumptive eligibility. This means that if a prenatal care provider determines that she is pregnant, she and the provider can fill out a very short form application at the provider's office. That short application with minimal information is faxed to an office in Sacramento, and the Sacramento office quickly sends back a document showing that she has immediate Medi-Cal eligibility. This is extremely important for a woman who is pregnant because it will immediately cover her prenatal care. With the document showing proof of her presumptive eligibility, she can obtain care and coverage from other prenatal care providers. However, it is very important that she understands that this coverage is temporary. This coverage only continues through the end of the month after the month of application. She must complete a full Medi-Cal application during her presumptive eligibility period in order to continue receiving Medi-Cal coverage for the rest of the pregnancy and through the postpartum period. It is also extremely important to complete a full Medi-Cal application because presumptive eligibility only covers certain care related to the pregnancy. Many advocates have found that it is very difficult to get coverage for non-ambulatory care if the woman has not completed a full Medi-Cal application. With pregnancy-related Medi-Cal, the woman is covered 60 days after the pregnancy ends. This is extremely important because it covers any complications she may have from pregnancy or from any complications from either a miscarriage or from an abortion. If an infant is born from this pregnancy, then that infant is deemed eligible for full Medi-Cal for up to 1 year, as long as the mother was eligible under the 200% program when the infant was born. Another important program for women is the Breast and Cervical Cancer Treatment Program, or BCCTP. Under this program, a woman may receive coverage for breast or cervical cancer treatment. This program is available to women in families with income up to twice the federal poverty level. The family's resources are not a factor in determining eligibility for this program. If she is a U.S. citizen or a qualified immigrant, the woman gets full Medi-Cal coverage. That coverage lasts for as long as she needs treatment. Since rapid access to cancer treatment is important, a person with cancer can apply for this program through accelerated eligibility. Similar to the pregnancy presumptive eligibility program, if a woman is diagnosed with breast or cervical cancer, she can get accelerated eligibility at the provider's office. She need only provide certain basic information about herself, including her Social Security number and a declaration of her gross income in order to get eligibility for coverage for the breast or cervical cancer treatment beginning that day. And like the pregnancy presumptive eligibility program, the beneficiary must follow up with a full Medi-Cal application in order for the coverage to continue. Undocumented women, men, because men do get breast cancer, and others without satisfactory immigration status can receive coverage as well. But the coverage is time limited and only covers the cancer-related treatment. Accelerated eligibility is not available to people who are eligible for this more limited state-funded program.